Hello everyone, and welcome back to the Pain Minute. I'm your host, Dr. Bathla. So today we're going to dive into a critical topic for anyone dealing with chronic pain, medial nerve branch blocks and their progression to radiofrequency ablation. Let's break it down. First of all, what are medial nerve branch blocks? These are actually targeted injections used to temporarily relieve pain from the medial branch nerves. These send pain signals from the facet joints in your spine. When these joints become arthritic, or when these nerves become inflamed or irritated, it can lead to significant discomfort. Now let's go through the process of getting a medial nerve branch block. So you'll start with a consultation with a pain specialist who will review your medical history and symptoms. On the day of your procedure, you'll be asked to change into a gown and lie down comfortably on your stomach. Using fluoroscopy or ultrasound, the doctor will precisely locate the medial nerve branch. After the injection, you'll be monitored for a brief period. Most patients will experience some immediate relief, but the true test is how you feel over the next few hours. If you find significant pain relief, it confirms that the medial nerve branch is a key player in your pain. It is important to remember that the block will only provide temporary relief, often only for the day of your procedure. Some insurances will actually require that we perform this procedure twice before we move on to the next step. Now, what happens if the block provides relief? That's where radiofrequency ablation comes into play. RFA is a minimally invasive procedure that uses heat generated by radio waves to target and disrupt the function of specific nerves. If you and your doctor decide that you want to proceed with the RFA, the preparation is very similar to the nerve block. Again, imaging guidance is used to locate the nerve, a thin needle is inserted, and radiofrequency energy is delivered, effectively heating the nerve and interrupting the pain transmission. After the procedure, you may experience some slight soreness at the site, but many patients find long-lasting pain relief. It is important to realize that it may take a few weeks for the effects to really set in. In summary, medial nerve branch blocks can be an excellent first step in managing chronic pain, and if successful, it may lead to radiofrequency ablation for longer-term relief. Remember, always discuss your options thoroughly with your healthcare provider. If you found this information helpful, please give us a thumbs up, subscribe, and hit that notification bell for more insights in managing your pain. And don't forget to leave your questions and comments below. Thanks for watching the Pain Minute, and I'll see you next time.